It takes a lot of experimentation to come up to make sure that what you've done, what you built out longitudinally is fulfilling the exact use cases just because of how pervasive this technology can be and how encompassing it can also be with the content that goes into training it too. Was it Cheyenne? GPT-4 had 1.8 trillion inputs or something into it in comparison to its predecessor. And so you can think about that as like, wow. But how do you kind of make this technology work for yourself? And that's going to always take on the experimentation route, making sure that you have a very judicious use case that you've really vetted out, a good hypothesis, use the scientific method to really approach it. And then say at the end is you also have to make the determination is this the right technology or not? Because you also have that type of balancing act. Sometimes the older technology, even though it is older, it gets the job done cheaper and more efficiently versus what is being done with generative AI. So you have to do that balancing act too. Additionally, what we also like to keep in play in our mind in our field in healthcare too is the regulatory implications that go on. How does that impact us? You know, President Biden just sent out an EO about some guidance about how AI should be working in this domain. ONC had a huge announcement going out. The WHO just came out with some more language too. So you have to also keep in mind that even though we may come up with some amazing solution, there's also regulatory bodies that we have to abide by. And, I mean, do we classify this as a medical device? Then you have to go through the FDA cycles to make sure that it goes through that. So like you have to think about it strategically from multiple lenses and invest in that type of directionality and scoping of your use cases and your activities behind it.